Hello and welcome back to the ITM Congress highlights of EANM 2024. Today we're day 2 and I think we already had a great day of nice lectures. And of course yesterday the entire conference started with the opening ceremony and then the highlights lectures. Ken, what do you take from that?
I mean, the opening was fantastic, right? We had more than 2,500 abstracts submitted. We have more than 8,000 attendees now confirmed, Karolien. So I already said yesterday more than 8,000, but now it's official. So I think it's absolutely great. We also had some entertainment. We had a false fire alarm, so it never gets boring at EANM.
That's true.
And content-wise, I think, Karolien, you're going to tell us a little bit about what were the highlights presented by our 3 speakers.
Yeah, so the 3 highlighters, they selected many abstracts that we saw. There was definitely a focus on oncology. We also saw some abstracts in the other areas such as neurology, infection, inflammation. And in oncology, there were some general groups of topics that were tackled. On the one hand, we had known targets, known radiopharmaceuticals that were being evaluated in new tumor types, new applications. And a second big topic was that there were a lot of, or that there will be a lot of presentations on new targets, new radiopharmaceuticals, and also new radionuclides that will be going through the clinical scenario. Then as a third topic, we saw some data which is very interesting on really the endpoint. So how does our imaging affect outcome of patients? How can we measure response in different tumor types? And then a final item that was tackled was, where would AI fit in? Is this going to take away our jobs? What can machine learning offer us? And what are new technological developments? We saw some pictures of a walk-through PET system, which looks at the moment still crazy, but who knows what the future will bring us. So these were for me the 4 big categories where we will hear lots of abstracts in this year's Congress.
So Karolien, something which is always very much associated with nuclear medicine is Marie Curie, right, for the discovery of activity. So we have 2 big highlights with Marie Curie associated. One is the Marie Curie lecture, you already mentioned yesterday, by Philippe Lambert. But even more important, yesterday, the Marie Curie Award. I think we had 3 really fantastic abstracts, if I remember correctly. All 3 of them were of oncology, which both of us, being very close to EANM Oncology Theranostics Committee, means a lot to us. Yep. But now, Karolien, tell us, who was the winner?
So the winner of the Marie Curie Award was the group of Damien Wild. And it was Julia Fricke, one of the residents, who presented her research on the phase 0 trial investigating a new treatment being terbium-labeled DOTA-LM3, which she tested in 8 patients with GAP-NET tumors. And she has shown us her results showing much higher tumor doses, up to 7 times higher compared to lutetium DOTATOC, while still having a favorable biodistribution in these patients. So I think it's one of these new radionuclides coming into the early phase clinical trials. And I'm sure that we will see many more of these kind of trials coming to EANM in the coming years.
Yeah, so if you don't know the details, right, you would think PRT, neuroendocrine tumors, what's new about, but there's actually 2 things, right? One side is terbium. The nice thing about terbium is it has the same or very similar properties as lutetium, but on top of it also has the Auger part. And this, of course, might add a certain efficacy. And the second thing, you mentioned DOTA-DLM3, right? The difference is an antagonist, somatostatin 2 receptor antagonist. And as we know, the somatostatin 2 receptor antagonists, they not only bind to the active, they actually bind also to the inactive G receptors. And this again hopefully increases the number of bindings to the tumor and potentially could explain the significantly higher tumor dose. This is something which I also am aware that it's going to be also commercially developed. So I think it's something we're going to hear again.
Yeah, so Ken, what was for you personally your highlights of yesterday's lecture?
That's actually a very nasty question. I'm still going to answer it because there were a lot of things we have seen before, right? A lot of tracers which are going to potentially never really make it to the clinic. However, there's one thing which I really take home I'm going to want to talk about, and it fits very much the pattern. It's actually somatostatin 2 receptor targeting in multiple myelomas. So you saw the abstract as well. Is it something you're going to look at as well? Or?
If I don't have to be sharing a session, I'm very happy to go and look at that as well. So I think multiple myeloma is one of these tumor types where we're seeing several new targets and also potential diagnostic and treatment tools coming into play. We may have CXCR4 also coming to the arena. So if I have the time, then I'm definitely going to have a look at that presentation as well.
So, and today we already had, I think, some fantastic sessions. One of them was continued medical education too. And the reason I'm mentioning that is because, Karolien, you're an active part of this. Tell us about the most important things about the session.
Yeah, I had the honor to be the chair of that session, and I must say that it was a great session because it showed us what the great data is that we have acquired over the last 10 years, so to say, in PSMA imaging on the one hand and therapy on the other hand. And I think this can be a great lesson also when we are moving towards new targets. For example, FAP, we're hearing a lot of things about FAP, but we need to be careful that we also get high quality data for these new types of imaging agencies. And I think here PSMA can show us also our mistakes, but we can also see what we then in the end did right. And I think the session really highlighted this very nicely, looking at the big data, also looking at what the future applications may be. So for me, this was a very, very comprehensive session, really targeting all what PSMA has to offer for clinical routine.
Also a huge turnout, right? And,
yes,
and
it
speaking
was
of huge
excellent.
turnouts, was not the only session you shared today. The second session you shared was the plenary.
Yeah.
And the plenary, I think, was very exciting because the topic was theranostics come of age. And I think theranostics is one of the biggest topics we have. Therefore, the session was actually divided into two parts. First of all, trying to think about how we enable theranostics. There were 3 talks. One of them was thinking about how can we actually start up and why should we start up a theranostics center. The second one was how do we make sure we have enough medical doctors trained for theranostics. And the third one was dedicated to how we challenge the last mile. How do we really make sure that the therapy is actually delivered to the patient. I found it super interesting. Even so, I have to say the second part, of course, was even scientifically more exciting because there we had 3 fantastic speakers telling us about where are we in prostate cancer, where are we in prostate cancer treatment, how early can we go. I think it was very nice to have Ursula Vogel, a medical oncologist from Lugano, tell us how she sees PSMA ligand therapy moving into earlier lines. Then Desiree de Andres from Paris, Gustave Roussy, told us about what she thinks about breast cancer, solid tumor, high volume. Everyone, when you talk to companies who is commercially interested, gets really excited. So I think we have a long way to go there, but there are many different options. And then the third one, I think it's the first time that we had a Chinese speaker on the plenary.
That was very good. And we also have people from China really participating and not only presenting, but also in the big arena. So that was very good.
Yeah, and he talked about FAP, he talked about CA9, and he talked about DROP2. And if I remember correctly, C70. So you see, it's there's more and more coming.
Yeah, absolutely. So as a conclusion of that plenary session, for me, it was clear that the age of theranostics, that is really now. And for me, especially the first part showed us that as a nuclear medicine field, we need to step into the arena. We need to be ready to treat our patients. We need to be ready for the tsunami of requests that are coming to our departments. We need to be ready and build buildings if we need to. We need to train the young generation, but we also need to train the older generation. So we really need to get on the train or get in the Volkswagen or get in the Ferrari or the Porsche or whatever fancy car you are driving. I'm driving the ID4, not an ID3, as you were mentioning in the plenary.
Sorry about that.
But for me, really the message was RNT, radionuclide therapy, radioligand therapy, however you want to call it, is something that we need to get into now. We have great applications at the moment, and if you look at what the future can offer, I'm sure that we really will see this tsunami of requests coming to us.
You just mentioned young generation. It's actually very good because we heard some baby crying in the background. We cannot start as early enough. But speaking about this, I think it's very important because one topic was also the nuclear oncologist. And I think it's very important, a very important concept, because it's not going to replace nuclear medicine. But when we talk about nuclear medicine, we have the term of nuclear cardiology. And I think we need to think more about nuclear oncology as an additional specialty or a special qualification on top of nuclear medicine. But we are not going to replace nuclear medicine, no worries.
Yeah, and this, I think also we heard it from several speakers. As nuclear medicine physicians, we need to be present at the MDT. We need to know our stuff. We need to be able to discuss with our clinical colleagues at the same level. So we really need to step into the arena, as already said, not only regarding just administering the treatments in the best optimal way, but also know the disease that you're treating. No prostate cancer, no neuroendocrine tumors. So when you're at the MDT discussing patients, selecting patients for radionuclide therapy, your clinical colleagues will value you, and this in the end will really help the entire field of nuclear medicine move forward in the current age of theranostics.
Yeah. I fully agree with you, Karolien, and I also want to mention that in addition to the stuff we just talked about, we have a couple of more really exciting scientific sessions coming up today. There's going to be also a panel discussion on healthcare system readiness, something we kind of use as a cliffhanger for tomorrow. But this being said, you had a beautiful closing of the plenary, but you were not able to actually use it because people were kind of leaving. So I think now is a chance, Karolien, not only to finish and wrap up the day 2, but also recycle what you have prepared.
I think everybody was hungry and wanted to get some food at one of the very interesting industry symposia that are also available during the lunch break. So what I wanted to say is that, one, we are in the era of theranostics. We need to get ready. And please come back tomorrow, because then we will have a fantastic plenary 3. This will be not on theranostics, but we will look at how nuclear medicine can really answer all questions that you may have in a specific patient. There will be some oncology, but there will also be focus on many different areas where nuclear medicine can be of help. We will see rheumatology come in, psychiatry, some disciplines where you think, what are we as nuclear medicine physicians going to do in that area? You will know tomorrow if you go to the plenary 3.
I'm so happy to have you. I cannot imagine life without oncology. That's why I'm happy to have you next to me.
So we hope to see you again tomorrow here for a next video, where we will give you again our highlights of the past day and look forward to what the next day at this great EANM 2024 will offer you.